I think we're ready to start. The floor is yours, Professor Harabi.
Yeah, welcome back everyone for the afternoon session, which is really about the essence of Hadron therapy, pediatric oncology, and the role of Hadron therapy. Our first speaker from Mid-Austrum and head of the carbon project there is Professor Piero Fissati, and it's my pleasure to give you the floor, Piero. Are you already online, Piero? I mean, it's 1 minute past 3, so maybe he assumed we're running a little bit late. Just check the attendance online. If no one from Mid-Austrum is online yet, maybe we need to reshuffle our lectures a little bit. From the local speakers here, maybe I jump to Sabina. Is that okay for you? When we start with the third talk, Sabina Vennarini from Milano, and tomorrow we'll talk about Hadron therapy, state-of-the-art in pediatric oncology clinical aspects. Thank you so much, Sabina, for jumping in so quickly.
So I'm a radiologist and a radiation oncologist. I'm the chief in this moment of the pediatric unit radiotherapy from Ospedale Istituto Nazionale Tumori di Milano, and I'm medical consult for pediatric patients for CNAO. Oh, no problem. So, yeah. We'll try. So in this way I can change.
Yes.
So, okay, let's start my presentation, and before I would like to present my background. This presentation is divided in two parts. The first part is the role of pediatric radiotherapy in the treatment of pediatric tumor. The second point is pediatric proton therapy and its application in the treatment of pediatric tumor. And then, and finally, some clinical case. I would like to present it for support my rationality, clinical oncology of the use of proton therapy. In particular, I concentrated to my talk in the proton therapy, not to carbon ion, because there was the speaker before me, but so I can answer to the questions. So the first point is always to understand what's happened in the community, what's happened for the pediatric patient, what's happened now. It's a survival, yes, no. This is the first question usually the parents ask when you have an appointment for start treatment patient. Yes, finally we have a good result because 80% of the pediatric patient can survive. This is the first point you need to take into account, because survival, you must think survival is one of the first points, but quality of life and late effect of therapy represent a great field of interest. So, what is the role of the radiation therapy in the protocol, in the international protocol? Now we know very well what happens is in our country the multidisciplinary people when we decide the treatment of patient. And the problem is for the local control and the disease of this world is very strong on that. But what is the price of the survivorship? What is the price sometimes when you need to treat a very young patient and you need to take an account what's happening? The development of the lymphocytic when you use the radiation. And very important, we think about the quantity the secondary infection, either benign or malignant, it's because such a sequence of this treatment. If we think about his survival when you have a brain tumor and you use radiotherapy, this is a few late effect what's happened when you use that. It's only not concentrated on radiotherapy, but you have a chemotherapy to surgery. You need to put in time the dose and then the radiation therapy. So the age on the diagnosis of the disease. So the impact of this sequela has not only affect quality of life, but may also influence overall survival. This is another point I would like to stress about the use of radiation and on radiation X-ray radiation. You need to take into account another point. Following the follow-up, you need to understand what's happening in the survival, and you need to discussion that in multidisciplinary team. So again, quality of life and late effect a concept of primary importance in pediatrics. But what's happening now in the radiotherapy unit for pediatric patients? First of all, the endpoint is the proper sign of resource of effort already obtained. And the second point is a centralization of high specialization principle. With a network, a connection with a major pediatric oncology center. And also for the pediatric patient, we have now cell to the Hadron high precision X radiation therapy technique and particle therapy. It's important and I stress this concept with the yoga before to have a clinical experience for choice the good technique to apply to the pediatric patient. This is the price of the advanced technique. We have the benefit of the conformality who get a stereo organ at least near the target, but unfortunately when you use a multiple field, you pay always this price. When you are getting the most normal pushed around the target, this is a very important for the content impact of this concept. This experience of the very important group, the Boston group, earned the paper 2002. In 2002, New York wrote this paper and she explained very well the group in pediatric cancer survival population than the other population where we see to develop secondary malignancies. So she explained to those volume age a very important factor for developing a secondary malignancy. So protein therapy in 2002 was more recommended to the patient to handle the patient for this type of disease. Therefore, it's normal now to introduce the protein therapy. it's a long way in production, the proton therapy, because if we have clear this concept, the importance of the late effect in pediatric cancer, I think we understand well the indication of proton therapy. So us, of course, we know the particularly physical characteristic, property of proton therapy, but for us, for clinician, what is the benefit in terms of application of proton therapy? First of all, less doses to healthy tissue. Right side, late collateral effect, and now we know why and understand, with the inferior incidence of secondary cancerogenesis increase improved quality of life, but left side, very important, to less acute collateral effect with increased compliance of treatment, maybe chemotherapy, and the escalation of the dose of the target, it's very important to improve local control for overall survival in some very special type of disease. This is a whole consensus in 2015. We met in Stockholm and we started to talk about what was the indication of proton therapy, and the result was this. So if you see them well, only the high-grade glioma and venous tumor was the indication switched to proton therapy. In this moment, it's not completely enough because only for venous, if you have an interesting stage 3, if you have a last stage, maybe you will think about in the tumor. The difference region because it's not indicated, but for resource for survival in relationship to develop the late effect. So this is a very important thing. To understand the clinical application of proton therapy, you need to see this point. Historically running resistance, you need to increase the percentage of the survival in the long run. Second point, finally, with the following prognosis. In this case, the long-term favorable outcome and improve the quality of life. Very complex volume. It is a typical example of spinal modulation. The age of the patient. We see in the first slides, the age is one of the factors for develop the late effect in patient survival. So it's very clear, consequently, proton therapy is increasingly used worldwide. So pediatric cancer and high proportion of very young children is critical. So we are not surprised. CNS location is one of the best indication for proton therapy because it's the second most important number in pediatric patient. Some data you see very well. 1,080, 54 patients have consented and enrolled in the register PPCR. From October 2012 until September 2017. And now, some example, just to understand the rationale we presented here for use of proton therapy in pediatric patients. Was difficult case we treat a long time ago in 2015 and for the patient, very high resistant tumor. The kids present is this model very inflamed to the spinal cord. You can find the probability and this escalation so was 72.8 and was a combination to clinical knowledge in radiation field, because this model was incredible, because we monitoring, because I was being afraid for the kids when I took this patient, and my surprise was this model shrinking and the end of the proton therapy. He was very strict. This is a typical example to understand when you practice proton therapy and you have this escalation of the dose to monitoring always the treatment, because sometimes we need to plan or we need to understand what's happening for the children. Then we publish this case and we ask to the pathology to understand what's happened. And she explained me was different compound, undifferentiated compound, more aggressive, response very quickly, and the stable disease was the nodule of the cordoma. This is a typical case of we push the quality of life, because the germinoma case is good prognosis, is one of the malignancy tumor affect the kids in different age. You see the comparative plan, but it's important to take into account this complex volume is a ventricular evaluation, because normally the pattern of the legs is inside of the ventricle. And this is a typical primary performing implantation. Other complicity, diseases benalis, chronic pharyngioma, is fortunately the disaster of this type of disease, because the anatomical region is very complex, because you have a lot of coordinate risk around, and it's stress always this part of my talk. Excellent imaging acquisition for well define your target volume and for monitoring what's happening with proton therapy. And this is a planned performance, and these kids was affected to congenital carcinoma and excellent resolution and we call it the carcinoma, and the carcinoma. For example, very complex, young kids, children with sarcoma. You see that the field was operated by the unit of the surgery, and of course, not operation, the radiotherapy and chemotherapy concomitant in abdominal sarcoma parameningeal, excellent spreading of normal tissue at contralateral size. Just for finish, it's impossible not to talk about the chronic span radiation, one of the most common techniques used in pediatric patients. So the very common medulloblastoma disease. In this moment, I'm the chief of this protocol in Europe. And we have a lot of patients with more protocol. And of course, you need to talk about the evolution of this technique between clinical approach. We can tell exactly the hematologic toxicity, maybe we can have in mind to use some content with the carbon therapy, usually that's the thank you. I usually find my presentation with one of my mentors, Banjo. It's only talk about more cure for pediatric patient. It's not enough. Thank you.
Thank you so much for your talk and for emphasizing why it is so important that we offer the kids the ideal treatment. I really like the talk. Are there any questions from the audience? Maybe a comment from my side. You really said the last sentence, cure is not enough. It's really not only about treating the disease, but what comes after. You clearly show the long life expectancy and that it's very important to ease the burden of those late side effects.
totally agree with you. It's one of my very important points when I chose which technique, and I push always the multidisciplinary group to get together WhatsApp and after, because I was very impressed to the social sequencing. Put in one of my slides, one of the best authors for the social sequencing is Offerman from Memorial Sloan Kettering of New York. It's impressive. If you think about young lady without hair, okay, for us it's nothing, but for her it was stress. Now we have a session. It's very important, but it's not goal. It's a reality, a big problem. I think before choice a technique, think about all the things, but first of all, the effect.
Thank you. Wonderful. Thank you. Thank you very much.
Just one more minute, please.
Yeah, here closes the session in this room, but I just wanted to remind you that in the main auditorium, Professor Roberto Orecchia and Arnold Campos are giving a presentation in the framework of the Aristotle Medical Forum in the session of the role of artificial intelligence in radiation therapy. So I encourage you to just step in the main auditorium. Thank you very much.